Whiplash injuries are not simply neck sprains or isolated soft tissue issues. They are, in fact, complex cervico-kinesthetic system (CKS) injuries. The CKS integrates cervical spine structures, vestibular input, ocular reflexes, and proprioceptive feedback to control head, neck, and postural stability. When injured in a whiplash event, this system can become dysregulated, leading to dizziness, imbalance, visual disturbances, cognitive complaints, and chronic pain, not just localized neck discomfort. Recognizing whiplash as a cervico-kinesthetic system injury reframes it from a minor musculoskeletal strain to a multi-system neuromuscular impairment requiring comprehensive, multidisciplinary assessment and care. This is why the treatment you seek determines whether you recover or not. Understanding injury. Most whiplash injuries occur at very low speeds. Research has shown that up to 90% of those injured occur at speeds of less than 15.43 miles per hour. Whiplash trauma is not a simple back-and-forth neck motion. In milliseconds, a collision subjects the cervical spine to at least 6 simultaneous forces: rapid flexion, extension, compression, tension, shear, and torsion. These combined loads far exceed the physiological tolerance of the cervical and cervico-kinesthetic systems, producing microtears, joint capsule injury, ligamentous laxity, altered proprioception, and neurosensory disruption. This is why whiplash can be profoundly disabling, with symptoms extending well beyond localized neck pain. These trauma findings were discovered at Yale Medical School in not one, but 2 separate studies. Whiplash trauma is not a simple back-and-forth neck motion. In milliseconds, a collision subjects the cervical spine to at least 6 simultaneous forces: rapid flexion, extension, compression, tension, shear, and torsion. These combined loads far exceed the physiological tolerance of the cervical and cervico-kinesthetic systems, producing microtears, joint capsule injury, ligamentous laxity, altered proprioception, and neurosensory disruption. This is why whiplash can be profoundly disabling, with symptoms extending well beyond localized neck pain. These trauma findings were discovered at Yale Medical School in not one, but 2 separate studies. Common symptoms associated with facet, disc, and concussion injury after whiplash include persistent neck pain and stiffness, headaches, especially at the base of the skull, shoulder or interscapular pain, arm pain, numbness or tingling, dizziness or vertigo, visual disturbances, blurred or double vision, light sensitivity, cognitive or memory difficulties, concentration problems or brain fog, fatigue or sleep disturbances, tinnitus, ringing in the ears, balance or coordination, difficulties, increased sensitivity to noise or motion, emotional changes such as irritability or mood swings. If whiplash injuries are not properly assessed and treated, the condition can become a progressive disorder rather than a self-limiting injury. Over time, untreated whiplash can lead to muscle atrophy in the neck, with healthy muscle tissue replaced by fatty tissue. Chronic pain signaling increases as pain fibers become sensitized, amplifying the perception of pain, so you feel more pain, even as healing is occurring. Additionally, prolonged neck and brain trauma can result in structural and functional changes in your nervous system, including reduced brain size, similar to what is seen in Alzheimer's patients, in areas responsible for cognition, memory, and pain modulation. This is why early, targeted, and comprehensive care is essential to prevent long-term disability. Untreated whiplash not only damages the neck and cervico-kinesthetic system, it can also reduce blood flow to the brain. Reduced cerebral perfusion contributes to fatigue, cognitive slowing, and increased risk of long-term neurological issues. Other clinical conditions associated with chronic reductions in brain blood flow include mild traumatic brain injury, concussion, CTE, vascular dementia, Alzheimer's disease and other dementias, stroke and transient ischemic attacks, and migraine and chronic headache syndromes. This demonstrates why early, precise intervention for whiplash is critical, not just to manage pain, but to protect long-term brain health and neurological function. Insurers and insurance-appointed doctors often describe whiplash as a self-limiting injury, implying that symptoms will resolve quickly without intervention. This notion originates from the Quebec Task Force guideline, based off of research from the 1980s, whose primary goal was to limit medical and rehabilitation costs, not to guide optimal patient care. In practice, for auto insurers, it is often more cost-effective to rely on medical doctors to deny coverage for physical medicine treatments and then shift the patient's treatment needs onto OHIP, even though most physical medicine therapies are not covered. This approach frequently forces patients to rely on medications, while insurers save billions of dollars. The truth is that whiplash is frequently a chronic condition. A review of nearly 100 peer-reviewed studies shows that, on average, 52% of individuals sustaining a whiplash injury experience long-term pain and disability, highlighting the need for early, comprehensive assessment and treatment rather than dismissing the injury as minor or temporary. The scary truth: using pain medications for more than 30 consecutive days, according to the American Academy of Pain Management, will actually increase your perceived pain. Having prolonged pain, regardless of intensity, according to the American Pain Society, will actually shrink your brain by 1.3 centimeters per year. And according to Stanford Medical School, this continued pain process can age your brain by 10 years. In Ontario, medical doctors operate within the OHIP/Medicare system, which only covers medically necessary services, typically those provided by physicians or in hospital settings. Services outside this scope, such as most physical medicine therapies, are usually not publicly funded. Insurers exploit this system by having chiropractic treatment plans assessed by medical doctors, whose training and scope are limited to acute or critical care. As a result, these assessments systematically fail to address common whiplash-related injuries, such as vestibular impairment, proprioception loss, neurological maladaptation, pain referral, or functional loss, while allowing insurers to deny coverage as not medically necessary. Has this happened to you? This practice constitutes a form of systemic discrimination against chiropractors, reducing claim costs by compartmentalizing the patient's injuries and ignoring the totality of care needed. Statistically, such policies allow insurers to reduce whiplash-related costs by an average of 69% annually, despite the majority of traffic injuries being classified as injuries rather than serious injuries. According to Stats Canada in 2019, there were a total of 140,801 injury claims. By limiting injury claims to the minor injury cap of $3,500 instead of allowing full benefit treatment under your policy of up to $50,000, auto insurers in Ontario have the potential to save $5,208,450,000 per year, yet your premiums keep going up every year. To prevent whiplash from becoming a chronic, disabling condition, it is essential to see the right healthcare providers early and receive the appropriate treatment. This means consulting clinicians who understand the full spectrum of whiplash-related injuries, including facet joint, disc, vestibular, proprioceptive, and neurological impairments, and providing targeted physical medicine therapies rather than relying solely on acute care medical assessments. Early, comprehensive care can reduce long-term pain, restore function, and protect brain and nervous system health. When it comes to whiplash, trust the doctor who is recognized across North America and Europe as the authority responsible for teaching other doctors how to assess, diagnose, and treat these complex injuries. Take control of your health. Get the treatment you need to recover, restore function, and reclaim your life. Early, expert care is your best path to lasting recovery and a return to the activities you love. Personalized one-on-one care. You will only be treated by Dr. Mazzarella or Dr. Merrick. No interns, no students, no associates, no unregulated staff. Your care is in our hands. Most visits will be at least 1 hour in duration and will include a variety of services such as chiropractic care, acupuncture, physiotherapy, exercises, neurokinetic therapy, pulsed radiofrequency, alpha stim, laser therapy, PMF, ultrasound, heat, ice, neurocognitive rehab, biofeedback, and neurofeedback, to name a few. Each treatment session will be tailored to your specific needs, and each session may be different based on your responses to treatment. Hurt in a car accident? Don't wait. Space is limited as all treatments are only provided by Dr. Mazzarella or Dr. Merrick. Get the treatment you deserve and need to recover fully. Early expert care makes all the difference. Please schedule all new patient appointments using our online booking system that can be found on our website, drjasonmazzarella.com.